Could previous exposure to the common cold coronavirus be offering protection for COVID-19? Find out here today on Jimmy Rants. Click on that little box down there in the corner. It'll take you straight to IGTV for today's episode. JimmyRants.com is the website, and as always, engage live in the content. You got to go follow me. It's right here on Instagram. I am at Livin' Low Carb Man, LIVINLOWCARBMAN. Once you're there, engage live. We are here Monday through Friday at 11 a.m. Eastern Time, so always, just assume I'm going to be going live at 11 a.m. So thank you guys for being here today. We also simulcast over here on my Facebook page. So thank you guys for being here today. We also simulcast on my YouTube stream. So thank you all for being here today on Jimmy Rants. If you missed the live, you can watch it on replay right here on Instagram. It goes right up to IGTV right after the show is over. So go check it out as soon as the show is over. You can see it and see it on demand on IGTV. You can also see it on demand over on YouTube. Just type in a keyword Jimmy Rants. You'll find the show. If you want to go directly to my channel, it's youtube.com/livinlowcarbman. And by the way, we have a bonus episode over there today. So Jimmy Rants bonus episode is today's episode of Real Talk, my podcast that airs on Thursdays. Jason Carter, he goes by the Ketopocalypse, and he and I had a great conversation about all kinds of things. He is a registered nurse in New York City, so he's been right there on the front lines of COVID-19. And he's lost a ton of weight eating kind of a keto carnivore type of diet. And he has some really unique views as it relates to the social justice stuff that's going on. So go watch it right now over on YouTube. Well, not right now. Please stay to Jimmy Rants. But when this is over, go over to YouTube and watch that special Jimmy Rants bonus episode. And then finally, pop on over to JimmyRants.com. It's the official website for this show. And you can see all the past episodes while you're there. And if you like what I do here, you can support my work. I definitely have shifted over you guys to doing basically all viewer and listener supported. So if you guys love what I do, please support me. Some people have said I want to give a one-time donation, so we have a PayPal link at JimmyRants.com for that. And then others want to support on a monthly basis. So we do have a Patreon page if you want to go support that. Patreons we already have. Next week's episodes are already up there for you to go watch. Dr. Ben Bickman and one other. It's Rob Frankfurt who came up with an entrepreneurial kind of thing for helping keto companies kind of get off the ground. So go watch those if you are a Jimmy Rants Patreon supporter. Okay, so thank you for being here today. I have some interesting things to share today because this week's bonus episode or the best of episode, of Jimmy Rants that aired on the Livin' La Vida Low Carb show, I've gotten a lot of great feedback from it because it was in that episode, and you'll recall, those of you that watch regularly, you'll recall it was several weeks ago that I did this whole Jimmy Rants all about T cells. And how a lot of people aren't showing the antibodies because their T cells in their immune system helped to beat back COVID-19 without producing any antibodies, and the person never had any ill effects in their health or minimal ill effects in their health. So they told me, did you know there was research a couple of years ago that showed how you boost T cell production simply through the act of chewing? And I was like, what? So I looked it up. I found the study, you guys. This is going to be really fascinating for those of you trying to boost your immune system because of COVID-19 and wanting to put yourself in the best possible position. Listen to this study. Research finds that chewing food can trigger the oral release of Th17 cells. That's a type of immune cell that can help to protect against infection. Chew your food. It's a phrase likely to have been heard many times during your childhood, and in this study, you would be wise to be taking that advice because researchers found that the simple act of chewing food prompts the release of an immune cell that protects you against infection. This study was published in the journal Immunity. This was from 2017, by the way. It found that chewing food, otherwise known as mastication, can stimulate the release of T helper 17 cells in the mouth. These Th17 cells form a part of what's called the adaptive immune system, which uses specific antigens to defend against potentially harmful pathogens while enduring the friendly bacteria that can be beneficial to health. So the study team was led by Dr. Joanne Conkle of the University of Manchester in the UK. In the gut and the skin, Th cells are produced through the presence of friendly bacteria. However, the researchers did note that the mechanism for why this helps is unclear. So that's interesting to note. Dr. Conkle and her colleagues note that the mechanical force required by chewing your food leads to a physiological abrasion and damage in your mouth. Did you think about that? Like when you chew, like sometimes you'll bite the side of your cheek, or you'll bite your lip, or you bite your tongue, and that's an obvious abrasion and damage in the mouth. But did you know when you chewed, you actually created this kind of damage in your mouth? So with this in mind, the team set out to investigate whether such damage might play a role in the T cell production. The researchers came to their findings by feeding weaning mice soft-textured foods, which required little chewing, until they reached 24 weeks of age. Then at 24 weeks, the release of T cells in the rodent's mouths was measured. A significant reduction in the oral T cell production was noted, which the team speculated was down to a reduction in the amount of chewing that was causing physiological damage. So confirming their theory, the researchers found that increasing the level of physiologic damage in their mouth simply by rubbing the oral cavity with a sterile cotton applicator actually increased their T cell production. Now that's interesting. Now, I'm not recommending this. Please do not take this and go try this at home. But I wonder if we could boost our own T cell production. Obviously, they're going to conclude here by chewing more when you eat your food, but by taking some kind of action to create abrasions in the mouth. Now that sounds so wackadoodle, right? Like I'm not recommending this, but I'm just thinking out loud here. If they're finding that that induces a T cell production, which could help to fight off an infection like COVID-19, why would we not consider it? Again, I realize it's a little out there. I'm not recommending it. Dr. Conkle and his colleagues believe that these findings indicate that chewing food can actually protect you against illness. The immune system performs a remarkable balancing act at barrier sites such as the skin, mouth, and gut. It fights off harmful pathogens while tolerating the presence of normally friendly bacteria. Our research shows that unlike other barriers, the mouth has a different way of stimulating Th17 cells, not by bacteria, but by simply chewing, and the chewing process that creates abrasions in the mouth, which then stimulates the T cell production. Therefore, it's this chewing that can induce a protective immune response in our gums. Fascinating, right? So there are some downsides that they noted to this. They caution that increasing oral T cell production may not always be beneficial. Too many of these cells can actually raise your risk of periodontitis, or gum disease, which has been associated with numerous other health conditions like diabetes and rheumatoid arthritis. In their study, the team also found that long-term exposure to this damage in the mouth can exacerbate the gum disease. They came to this finding by feeding weaning mice hardened food for up to 24 weeks. Compared with the mice that were fed soft food, the mice fed hard food showed more damage, more physiological damage in their mouths, and an increased risk of periodontal bone loss. Still, they believe that their findings could lead to new strategies to combat an array of illnesses, because it's the inflammation in the mouth that is linked to the development of diseases all around the body. But understanding the tissue-specific factors that regulate immunity at the oral barrier could eventually lead to new ways to treat multiple inflammatory conditions. I think what they're saying is it's the whole not too hot, not too cold, just right. That whole thing that is important here. They want to stimulate the abrasions in the mouth to get that inflammation, which triggers that T cell response, but not to the level that it's too much. Think about what the vaccine that they're working on for COVID-19 is supposed to do. It's supposed to stimulate an inflammation response so that the body learns to deal with that thing and thus increases your immunity to that because of the T cell production. Really fascinating. I was really appreciative to that Facebook follower who sent that information to me and said, hey, go look up that study. And so fascinating study, but it goes along with what I'm going to talk about here today. And if you're just joining us, yes, there is a lot of really interesting things coming out as it relates to COVID-19. Now, I knew this would happen when we started going down this path of this coronavirus and researchers started getting their grubby hands on testing some of these things and looking at these things a little bit deeper. And of course, a lot of the mainstream narrative of this is, well, we're doomed until we get a vaccine. So just do all the things, wash your hands, stay distant, stay at home, blah, 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 blah. And so people are obediently doing that. But what if previous exposure to other coronaviruses? Let's not pretend like COVID-19 is the first coronavirus on the block. We have been exposed to coronaviruses our entire lives. The common cold is a coronavirus. The seasonal flu is a coronavirus. And COVID-19 is a coronavirus. Yes, they're all different strains, all different kinds. But now, researchers are looking into, what about your exposure to these previous coronaviruses, offering up protection now for COVID-19. And maybe this explains why there are so many asymptomatic people who get COVID-19 and they don't see any symptoms whatsoever, and yet they got it and their body dealt with it primarily through the T cells. So there's no antibodies that show up. T cells did their job, took care of this problem, and everything was cleared. And you survived COVID-19. So let me get into this story. This was published in the Washington Post. 40% of people with coronavirus infections have no symptoms at all. Might they be the key to ending the pandemic? New research suggests that some of us may actually be partially protected due to our past encounters with common cold coronaviruses. During its 7-month global rampage, the coronavirus has claimed more than 700,000 lives. But Gandhi began to think the bigger mystery might be why it has left so many more practically unscathed. What was it about asymptomatic people as it relates to COVID-19 who lived or worked so closely to others who feel severely ill that protected them? Did the dose of their viral exposure make a difference? Was it genetics, or might some people already have some kind of a resistance to the virus contrary to our initial understanding? And this is what made me mad when all of this went down. Everybody started looking at, from the public health official standpoint, everybody started looking at models, and they created these models of the number of cases that would happen and the number of people that would die from it. They were just models. They were models based on really no data whatsoever. It was just guessing. Well, the guessing is what actually made us all go into lockdown. You'll recall, we need to flatten the curve so we don't have the however many deaths. They were saying that there was going to be millions of deaths, and we never got anywhere close to that. But that was the original guesstimation. Well, now that we've had a little more time pass and we've been able to observe the people that are asymptomatic versus the people who get symptoms versus the people that die, we kind of have a nice little kind of looking at this a little deeper. So the efforts to understand the diversity in the illness are finally beginning to yield results, raising hope that the knowledge will help accelerate the development of not just vaccines, but also therapies, or possibly even create new pathways towards reaching herd immunity, in which enough of the population develops at least a mild version of the virus that they block further spread and the pandemic ends. Here's the thing. we have no idea how close we are to herd immunity, because all the people whose T cells, which again is a part of your immune system, whose T cells have dealt with COVID-19, and you might have felt a little bit of symptoms and it was gone, or you felt nothing at all, but you never got to the point where you even had to go seek medical attention. What if there's enough of those kinds of people out there that we're really close to herd immunity? Makes kind of the talk about vaccines a little bit ridiculous, doesn't it? Especially when the death rate is still 0.03. And the more cases that are done and people aren't dying, that rate will continue to go down. And so at this point, it's really interesting that they're looking into this to see how close we are to herd immunity. Because if we have all these people walking around wearing a mask and doing all the things to protect each other, what if they're already protected because they've already had it and their T cells took care of it, and they're the asymptomatic people that already had COVID and it was a whole lot of nothing for them? A high rate of asymptomatic infection is a good thing, according to Gandhi, who is an infectious disease specialist at the University of California at San Francisco. What is this person's name? They just say Gandhi. They don't give any first name. So, all right, Gandhi, there you go. The coronavirus has left numerous clues for us. The uneven transmission in different parts of the world, the most mild impact happening on children. Perhaps much more tantalizing is the unusually large portion of infected people who had no symptoms at all. The Centers for Disease Control and Prevention last month estimated that could be about 40%. But they don't know. How do you know that it's 40%? Like, you can't test for T cell production. It's incredibly difficult to get to that without, and I mentioned this a few weeks back on that Jimmy Rants I did about T cells. It's incredibly difficult to test for T cells. It requires a biopsy and it's very difficult to get to, so people wouldn't put themselves through that. All we're relying on now is coronavirus testing, and we're also relying on antibody testing. But you're missing all of these asymptomatic people, which the CDC even admits is upwards of 40%, but it could be 60%. It could be 70%. We don't know. And then you add on top of that all the diagnosed people, the people who actually got COVID-19 and recovered from it, which we know is 99.7% of the people who get it. Are we actually closer to herd immunity than they even want us to know? And that's the thing that is compelling to me, is they keep wanting us to do all these things to prevent herd immunity, but what if we're this close and all it takes is just a little bit of deliberate interaction with one another and we're there? Now, the problem with that is there will be people that will die. There will be people that will get sick. I think if you feel like you're in the susceptible category, then stay home. Don't go out. If you feel that fearful of this virus, then stay home. The rest of us are actually going to live our lives, and we're not going to be in fear over a virus when it's been found to be not really that big a deal in the overwhelming majority of people. Again, I'm going to give this caveat. I'm sorry if someone in your life has been impacted by this, or if, God forbid, someone has died in your close proximity. I get the connection to that, and I'm not trying to minimize that. That's real for you. But you've got to look at this from the perspective of there are many things that kill people all the time. Heart disease, diabetes, cancer, everything, at a much, much higher rate than what this thing is doing. And so people are saying, okay, well, what if the T cells are actually doing their job and destroying this thing before it gets bad? We need to look at this. We need to pay attention to this. These clues have sent scientists off in all kinds of different directions. Some of them are looking into the role of the receptor cells, which the virus uses to infiltrate the body to better understand the role that age and genetics might play. Others are looking into face masks and whether they may filter just enough of the virus so that those wearing them have milder cases or no symptoms at all. So they're theorizing, okay, the reason some people are asymptomatic or mild symptomatic is because the viral load isn't that bad because they're wearing a mask. Now remember, they've told us wear a mask so you don't infect other people, but it's actually being looked at as a protective measure for the person wearing it. The theory that has generated the most excitement in recent weeks, that some people walking among us might already have immunity. That is a really good theory. And listen to this. When SARS-CoV-2 was first identified December 31st, 2019, public health officials deemed it as a novel coronavirus because it was the first time it had been seen in humans who presumably had no immunity from it whatsoever. There's now some very early tentative evidence, though, that suggests that assumption was probably wrong. One mind-blowing hypothesis that's bolstered by a flurry of recent studies is that a segment of the world's population may actually have partial protection because of their memory T cells, the part of the immune system trained to recognize specific invaders. This could originate from cross-protection derived from standard childhood vaccines, or, as a paper published recently in Science suggested, it could trace back to previous encounters with other coronaviruses, such as those that cause the common cold. So let's say last year, you got a common cold. We've all had it. We've all had a common cold. We've all been through the flu. We've all had those things happen. What happens? You have it for a little while. You take the NyQuil. You get through it. You do what you have to do to get through it. Well, what happens on the other end of it when you recover? You have antibodies for that particular coronavirus in your body. What they're saying here is, because this too is a coronavirus, even though it's different than we've ever seen before, because this too is a coronavirus, what if some of those antibodies and the strengthening of the T cells that happened from that exposure to that common cold coronavirus is actually offering you some protection that when COVID-19 hits your body, boom, it knows what to do because it recognizes that this is the big, bad, menacing cousin of the common cold. It's a fascinating kind of area that I'm glad they're looking into this. Francis Collins from the National Institutes of Health said that this might potentially explain why some people seem to fend off the coronavirus COVID-19 and may be less susceptible to getting severely ill. On a population level, such findings, if it's validated, could be very far-reaching. Yeah, you think? We're being told now, avoid this thing like the plague, because if you get it, again, the perception is if you get it, you've got the Black Plague, you're highly infectious, you need a quarantine for 2 weeks, and even if you have no symptoms at all, you need to quarantine yourself so you don't expose other people to kill them. I hate the whole vernacular around this discussion because they're making it seem like if you get COVID-19, it's a death sentence. And again, 99.7% of people who get it recover. They do. So this is not the big bad wolf that it's been made out to be. Hans Gustav Ljunggren, Ljunggren, Swedes have such funky names. A researcher at Sweden's Karolinska Institute and others have suggested that public immunity to the coronavirus could be significantly higher than what has been suggested by previous studies. In communities like Boston, Barcelona, Wuhan, and other major cities, the proportion of people estimated to have antibodies and therefore presumably be immune has mostly been in the single digits. But if others had partial protection from T cells, that would raise a community's immunity much higher. This is the whole monkey wrench and the whole thing about immunity and are we close to herd immunity, blah, blah, blah. You can't just rely on cases and antibodies. It's not enough. You're missing a huge third part of this. And I'm thinking that if we have a lot of people who had a little something happen to them, don't forget, I've been recently, I had that feeling of really fatigue and extremely tired and just, it was weird. And that was just last week. Was that me being exposed to COVID-19 and then my T cells fought it off and I had that as my symptoms? I don't know. Now, I am getting some antibodies tested just to see if I did get exposed to it and now I produced antibodies. But if the antibodies test comes back negative, that doesn't mean I didn't have it. It just means maybe my T cells fought it off. But see, that's the big unknown. We don't know how many people's T cells in their immune system actually fought this thing off. And that's why the whole, well, we can't reach herd immunity, we're nowhere near it. How do you know? We might be closer than anybody even realizes. If we do have a lot of people with T cell production, that would be very good news from a public health perspective, according to the Swedish researcher. Some experts have gone so far as to speculate whether some surprising recent trends in the epidemiology of the coronavirus, the drop in infection rates in Sweden, for example, where there have been no widespread lockdowns, nobody put on a mask, or the high rates of infection in Mumbai's poor areas, but little serious disease, might be due to pre-existing immunity. I want to ask you this question, and I've seen this asked a lot online. If COVID-19 is this big, bad, infectious disease that it's been made out to be, why aren't we seeing dead bodies in the streets of all the homeless people? Think about homeless people. They're out there. They're not wearing masks. They're laying wherever they can. You want to know why I think their immunity is probably higher? Because they're exposed to the filth of living on the streets. And so they probably have been exposed to all kinds of coronaviruses because of the unfortunate circumstances they find themselves in. What if their way of living is what's protecting them right now from COVID-19? Because I've literally not heard anybody talk about the homeless as it relates to COVID-19. Have you heard any stories about rashes of dead bodies in the street because of COVID-19 with all the homeless people? I haven't. And it makes you wonder why. Like, what's going on? What is special about them? And I think what's special about them is what we're talking about in this study today, that perhaps their exposure to some other coronaviruses built up enough immunity in their system to whack COVID-19 down. It's very interesting if you think about it. Others say it's far too early to draw any conclusions yet. Anthony S. is all it says, has touted the idea based on blood tests that 20% of some New York communities might be immune, 7.3% in Stockholm, 7.1% in Barcelona. Those numbers come from looking at antibodies that typically develop after you're exposed to a virus. Scientists believe that the T cells, a type of white blood cell that orchestrates the immune system, could be even more important in fighting it, as we've been talking about. Recent studies have suggested antibodies seem to stick around for only about 2 to 3 months. While work on T cells and the coronavirus is only just beginning, testing T cells is laborious, as we mentioned. One of the first peer-reviewed studies on the coronavirus and T cells was in mid-May. It was published in the journal Cell by Alessandro Setti, Shane Crotty, and others at the La Jolla Institute for Immunology near San Diego. The group was researching blood from people, and I talked about this the last time I talked about T cells, where they were looking at previous blood from 2015 to 2018. They were floored that 40 to 60% of these older samples, long before this novel COVID-19 coronavirus came around, it recognized SARS-CoV-2. The virus didn't even exist back then, but they had immunity at 40 to 60% rate. Research teams from 5 other locations all reported similar findings. One study from the Netherlands, T cells reacted to the virus in 20% of the samples. Germany, it was 34%. Singapore, 50%. The different teams hypothesized this could be due to previous exposure to similar pathogens. Perhaps fortuitously, SARS-CoV-2 is part of a larger family of coronaviruses, and we know that it is. So, could your body, having fought off some previous coronavirus, be offering protection now because your body has the T cells that can do what they're supposed to do to fight off infection? 2 of them, with SARS and MERS, are deadly, led to relatively brief and contained outbreaks. 4 other coronavirus variants, which cause the common cold, circulate widely every year, but typically result only in mild symptoms. They call them the lesser evils of SARS-CoV-2. This week, Sethi and others from the team reported new research in Science providing evidence that T-cell responses may derive in part from memory of common cold coronaviruses. The immune system is basically a memory machine. It remembers and fights back stronger, and that's important to remember here. If your body has fought off a really bad cold, you should be very happy you had a really bad cold previously. Because what that did was it told your body, okay, when this foreign invader comes into your body, here is how you handle it. Okay? So it gained wisdom from that, and now it remembers that. So when SARS-CoV-2, COVID-19, enters your body and the cytokine of a storm of inflammation starts to begin, your immune system says, we've seen this before. Your snotty-nosed little brother was here before. Well, now you're the big boy. Come here. We know how to handle you. And it handles it. And this could explain why some people are able to fight off COVID-19 asymptomatically. Their bodies know what to do. Interestingly, the researchers noted in their paper the strongest reaction they saw was against the spike proteins that the virus uses to gain access to the cells, suggesting that fewer viral copies get past all these defenses. In other words, before it even gets to your blood system, your immune system is going, bang, 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 bang. Fight that thing, and it doesn't even let it get into your body. That's why you're asymptomatic. The current model assumes you are either protected or you're not. It's a yes or no thing. But if some people have some level of some kind of pre-existing immunity, that might suggest it's not a switch, but more it's continuous. It's good stuff. Nearly 2,000 miles away at the Mayo Clinic in Minnesota, Andrew Badley was zeroing in on the possible protective effects of a vaccine, teaming up with data experts from Inference, a company that manages clinical data. He and other scientists looked at records from 137,000 patients treated at the health system to look for a relationship between vaccinations and the coronavirus infection. They knew that the vaccine for smallpox, for example, had been shown to protect against measles and whooping cough. Today, a number of existing vaccines are being studied to see if any of them could actually provide cross protection against COVID-19. The results have been intriguing. 7 different types of vaccines were given 1, 2, or 5 years in the past were associated with a lower rate of infection from COVID-19. 2 vaccines in particular seem to be a lot stronger in their link. People who got a pneumonia vaccine in the recent past appeared to have a 28% reduction in coronavirus risk. Those who got the polio vaccination had a 43% reduction in their risk of COVID-19. Vinky Soundarajan, the chief science officer at Inference, remembers when he first saw how large the reduction appeared to be, he immediately picked up the phone and says, "Is this even possible?" And I wonder, this research is public knowledge. I'm talking about it here today on Jimmy Rants. Do the people that are actually working on the vaccine for COVID-19, are they hearing this? Are they seeing these results? Are they thinking about the T cell in the production? We need to be asking these questions as these vaccines are being developed. And there's so many of them being worked on, so many different kinds being offered up. And they're all looking at it from a different mechanistic standpoint. I don't think we need to rush a whole bunch of different ones and let's just guinea pig everybody on these. Let's see what actually is working, if we need one at all. The team looked at dozens of other possible explanations for the differences. They adjusted for geographic incidence of the coronavirus, demographics, comorbidities, even whether people had mammograms or colonoscopies, under the assumption that people who got preventative care might be more apt to be socially distancing. But the risk reduction was still large. This surprised us completely, said the researchers. Going in, we didn't expect anything, or maybe 1 or 2 vaccines would show a modest level of protection. This study was only observational and cannot show a causal link, but Mayo researchers are looking at a way to quantify the activity of these vaccines on the coronavirus to serve as a benchmark for the new vaccines. They are consulting Moderna, which is one of the leading vaccine people that the companies that are looking at being used for the COVID-19 vaccine. If existing vaccines appear as protective as new ones under development, they could change the whole world's vaccine strategy. So whatever your belief is about vaccines, the fact that they're finding that the people that were recently injected with these previous vaccines, and they're seeing a huge amount of protection against COVID-19, that should be informative. It should also be informative that if those who had the vaccines for these other things means they've been exposed to those other coronaviruses, then just anybody who's been exposed to a coronavirus and your body was able to fight it off, you may have that same kind of protection against COVID-19, which would logically explain why we have a lot of asymptomatic people who get COVID-19 and don't even know it because they don't have any symptoms. Why? Because the previous exposure to other coronaviruses, most notably the common cold, is protecting them. At the NIH headquarters in Maryland, Alkis Togias has been laser focused on one group of the mildly impacted. They're looking at children. He wondered if it might have something to do with the receptor known as ACE2, through which the virus hitches into the body. We've talked about ACE2 before. In healthy people, the ACE2 receptors perform the important function of keeping blood pressure stable. The novel coronavirus latches itself to the ACE2 where it replicates. Pharmaceutical companies are trying to figure out how to minimize the receptors or trick the virus into attaching itself to a drug so it doesn't replicate and go through the body. So what they wanted to know in this research, if it's possible that children naturally express the receptor in a way that makes them less vulnerable to COVID-19. He said recent papers have produced counterintuitive findings about one subgroup of children, those who have a lot of allergies and asthma. The ACE2 receptors in those children were diminished. And when they were exposed to an allergen like cat hair, the receptors were further reduced. Those findings combined with data from hospitals show that asthma did not seem to be a risk factor for the respiratory virus, as expected. And that was intriguing to the researchers. We are thinking allergic reactions might protect you by downregulating the receptors. It's only a theory. So today, they're looking at how those receptors seem to be expressed differently as people age. They have 2,000 U.S. families in that study. By comparing those differences and immune responses within families, they hope to understand the receptor's role. Separately, a number of genetic studies show variations in genes associated with ACE2 with people from certain geographic areas like Italy and parts of Asia with having distinct mutations. No one knows what significance, if any, that these differences have on the infection, but it's an active area of discussion in the scientific community. Can I tell you, I am so glad the researchers are digging deep on this, because it seems to me that in the mainstream of what we're being told as individuals out here just kind of waiting for what they're saying, there's real research happening. We're not hearing about this research, which was one reason I wanted to talk about this here today on Jimmy Rants, is these are the kinds of stories that I think are intriguing, that we the people deserve to hear about. What are they working on? What's the preliminary results? And trying to figure this thing out. I don't think this slow drum beat to a rushed vaccine is necessarily the answer. And they're finding there's other mechanisms. There's previously used therapies that are going to be quite effective at dealing with COVID-19. Before the pandemic, researchers specialized in HIV, that Gandhi guy, but like other infectious disease experts these days, she has spent many of her waking hours thinking about the coronavirus. And in scrutinizing the data on outbreaks one day, she noticed what might be a pattern. People were wearing masks in the settings with the highest percentage of asymptomatic cases. The numbers on the two cruise ships were especially striking. In the Diamond Princess, where masks weren't used and the virus was likely to have roamed free, 47% were asymptomatic. But in the Arctic-bound Argentine cruise ship, where an outbreak hit in mid-March and surgical masks were given to all passengers, and N95 masks to the crew, 81% were asymptomatic. Similarly, high rates of asymptomatic infection were documented at a pediatric dialysis unit in Indiana, a seafood plant in Oregon, a hair salon in Missouri, all of which were wearing masks. She was intrigued by countries like Singapore, Vietnam, and the Czech Republic that had population-level masking. They got cases, but they got fewer deaths. The scientific literature on viral dose goes back to around 1938 when scientists began to find evidence that being exposed to one copy of a virus is more easily overcome than being exposed to 1 billion copies. Researchers refer to the infectious dose as ID50, or the dose at which 50% of the population would become infected. While we don't know what that level might be for COVID-19, previous work on other non-lethal viruses show that people tend to get less sick with lower doses and more sick with higher doses. A study published in late May involving hamsters, masks, and SARS-CoV-2 found that those given coverings had milder cases than those who did not. In an article published this month in the Journal of General Internal Medicine, Gandhi noted that in some outbreaks early in the pandemic in which most people did not wear masks, 15% were asymptomatic. Later on, when they started wearing masks, that rose to 40 to 45%. She said the evidence points to masks not just protecting others, as U.S. health officials emphasize, but also protecting you, the wearer. She makes the controversial argument that while we've mostly talked about asymptomatic infections as terrifying due to how people can spread the virus without knowing it, it could also end up being a good thing. It's intriguing that asymptomatic infection triggering immunity may lead us to get to population-level immunity, herd immunity. That itself will also limit the spread. Really, really, really fascinating stuff, you guys. And I think the more we learn about COVID-19, the more we learn about the people that have been exposed to this virus directly and have recovered from it or exposed to it, had the feelings, like I would hope that they could do a study somehow. I guess it would be a very subjective study. But if you felt like a little something, but it didn't rise to the level of going to the doctor. Like I said, last week, I was flat on my back Wednesday through Friday last week. I was sick, and it was just out of the blue, came out of nowhere, super duper dippity tired. I had diarrhea. I had different kind of things. Was that COVID-19? I don't know. I doubt it. There is still things called stomach bugs and other things that are out there that could have caused some of these symptoms that I had. All I know is I woke up Saturday morning and boom, I was back. But it was bad there for a few days. Was that my body fighting off COVID-19? I don't know. And if my T cells fought it off and there is no production of antibodies, there would be no test that I could do that could actually show that I had exposure to COVID-19. And again, I ask the question, if we don't know how many people are in that group where their T cells did their job, how do we know whether we're close to herd immunity or not? We don't. So perhaps you've been exposed to the common cold coronavirus or some other coronavirus that you fought off before over the past couple of years. Could that be offering you protection now for COVID-19? It's something really cool, and I'm glad to see researchers looking into this. All right, let's see what you guys have to say. I'm going to come over here to Instagram first, then over to Facebook, finally over to YouTube. Thank you all for being here today on Jimmy Rants. JimmyRants.com is the website. Go check it out, you guys. See if you have any comments here. Linda says, sounds like me today and yesterday. Have to head back to bed. Yeah, Linda, it sucks. Like when you get this heavy feeling, like I so bad wanted to do Jimmy Rants last Wednesday and Thursday, and even Friday when I did the Ask Me Anything last week and I came on camera, I was not myself. I was still pretty weak. I was better. I called my mom that day and I said, well, I've been really sick the last 2 days. Why didn't you call me? I wouldn't have been able to talk to you because I was so tired. So I hope you feel better, Linda. I've heard many a people talk about the getting tired. Of course, let's not underestimate that some of that might be stress related because of all the everything that's happening. So 2020 is just a funky monkey year, isn't it? So thank you, Instagram. Let's pop over here now to my Facebook page. See what you guys have to say. So would chewing gum work as well, says Deborah. So if you missed the beginning, yes, I talked about the act of chewing alone. There's a study that found the act of chewing creating abrasions in your mouth. Here it is. Creating abrasions in your mouth that would then cause inflammation that would create a T cell response, and that would boost your T cell production, which they, in the study, said actually makes you more immune to viruses. It's an interesting thing. So I would think just the act of chewing anything, Deborah, would work. They did not say anything about gum in here. They were just talking about chewing food. But I would assume if you're chewing gum, you're probably creating those abrasions in your mouth as well, and that too would also raise T cells. So good question. Tracy says, I went on a cruise in August last year, was out of the country, ended up getting really sick. The doctor called it viral bronchitis. I had to get a breathing treatment and inhaler. I was inflicted. I wonder now if I had coronavirus at the time. It took a month to feel better. Well, you might not have had the coronavirus, but the COVID-19 coronavirus. You might have had just another virus. I'll tell you this. When I get back from a cruise, I almost always am sick. It's almost impossible to be on a cruise ship with that many people densely populated on a boat where nowhere to go. Until you go into port, there's nowhere to go. You're all kind of like next to each other. And so, yeah, I always get sick. And of course, they have little hand washing things all over the place. I can't imagine anybody going on a cruise ship anytime soon. Like, why would you put yourself through that? 2020 is definitely gone. 2021, probably gone. Maybe 2022, but I wonder if by then there's so many financial losses in the cruise industry that they couldn't sustain it. I just think a lot of people are so fearful of other people now that I think the cruising industry is in big, big trouble. But yeah, I always got sick coming back from cruises too. And maybe some of that sickness is what has helped protect me against COVID-19. I don't know. Thank you, Facebook. Let's see what YouTube has to say over here. I constantly bite the inside of my lip when I'm unknowingly stressed, says Shirley. Now I'm curious if doing something like that activated those cells. Could be. That would definitely create abrasions in the mouth that could do the same mechanism of what they're talking about in this study. So it's really fascinating, guys. And I want you to be encouraged. Like, I feel such a heaviness in people's lives right now. People are so worried. They're so uncertain. And of course, let's not pretend like some of this isn't by design. Okay? I don't want people to think that all of this negativity isn't for a purpose and a reason. I think it is for a purpose and a reason. I think we need to stay encouraged. You need to be confident that if you're doing really good things for your health, keep doing those things for your health. You don't let fear take over your body. You don't, because if you do let fear take over your body, guess what it does? It takes over your body. And you live your life in such a way that you let other people kind of manage which direction you go in your life. I, for one, only have one person that manages which direction Jimmy Moore goes in his life, and that's Jimmy Moore. And I want you to be empowered. We don't need discouragement. We don't need to be fearful. We need to just live proudly as who we are, being who we are, not being afraid of anything, saying what you want to say, being what you want to be. Like, can I get an amen to that? Because it's like, I feel like people are being pressured into being caught up in this whole chaos of 2020. I think we're all over 2020, and there's nothing we can do about it except just keep going through life. But this has been a very, very, very interesting time in all of our lives that I think we won't soon forget anytime soon. But man, I feel an extra burden in my heart lately to just encourage people and to tell you to be who you are and to stay true to who you are and show love and show kindness and be all the things, because this is a very, very difficult time for us. And of course, you add COVID-19, you add the race relations stuff, you add the presidential election, and then all of that is on top of all the problems in your own life. I'm going through a pretty major thing this year that even if all those other things weren't going on, it was going to be a sucky year for me. And you just kind of go through those things. That's what it is. But when you have those things and then those things on top of those things and these things and that, it just can get overwhelming. And I'm burdened by the fact that so many people are succumbing to it, either through anxiety and depression, resorting to erratic behavior. They're eating themselves out of house and home. You know who you are. And no judgment from me. It's just, you can sense the pressure in the air. And to me, it's just unfortunate. So be good to yourselves, guys. Don't give in to all the chaos that's going on. Stay true to you, and never back down from that position. That's it for this episode of Jimmy Rants. JimmyRants.com is the website. And as always, you can engage live in the content. Go follow me over here on Instagram. I'm at Living Low Carb Man, LIVINLOWCARBMAN. Once you're there, engage live. We are here Monday through Friday, 11 a.m. Eastern Time. So be sure to mark your calendar and always be here 11 a.m. Eastern Time right here on Jimmy Rants. We also simulcast over here on my Facebook page. So thank you guys for being here, as well as over on my YouTube channel. Thank you all for being here today on Jimmy Rants. If you missed the live, you can watch it on replay here on IGTV. We also put the replay up over on YouTube. Just type in a keyword Jimmy Rants. You will find the show, or youtube.com/LivingLowCarbMan. And don't forget, we got a special bonus episode over on YouTube. Jason Carter, a registered nurse in New York City. We talked about COVID-19, what it was like for him to work on the front lines when all the chaos was happening in New York City. We talked about his keto carnivore transformation, because he's got an incredible story there. We talked about the social injustice stuff. We talked about everything. So go check out that special bonus episode, or you can listen to it on the Real Talk podcast today, llvlc.com. And then finally, pop on over to jimmyrants.com, see all the past episodes there. But if you like what I do, if you like what I share here, if you feel like you get value out of this, I really want to underscore that I am seeking to make all the work I do listener supported, viewer supported, because I think the sponsorship model served me well for a while, but I just feel a burden that there doesn't need to be any sponsors anymore. There doesn't need to be anything like that. Now, I may have to go back to that at some point, but I would like to not go back to that. So if you like what I do and you want me to keep doing podcasts and Jimmy Rants, go over to jimmyrants.com, click on the Patreon link. It really does help out. You don't even have to pledge that much. You can pledge as low as $5. There are higher levels as well, but any amount would be greatly appreciated. I've had a bunch of people do it recently, but I'm always game to have more people join and do that. Or if you like to send a one-time donation, there's a PayPal link there as well. And once it reaches a certain level, I will actually start providing exclusive content just for the people that support my Patreon. So thank you all for being here today. I will be back again tomorrow. Tomorrow is Ask Me Anything. So if you've never joined me on Fridays at 11 a.m. Eastern Time, I do literally Ask Me Anything. It's one of my funnest shows of the week. I never know what you guys are going to ask. So get your questions ready that you want to ask about me personally, about keto, about cholesterol, fasting, whatever you want to know. Let's have a chat tomorrow at 11 a.m. Eastern Time. So be here for Jimmy Rants. And until then, we'll see you then. All right.